Okay, I said I wasn't going to do another video until probably a week from the last one, unless there were developments, and there have been developments, so now I feel that I must. Um, it is the 16th, it's Saturday afternoon, which means it's been 12 days since the surgery. I was told when I saw the doctor on the 12th that the steri-strips would probably start peeling off soon, and that was fine, and if they hadn't peeled off already, I should take them off by the 18th, which is 2 days from now. Um, today they were kind of starting to peel off in the shower, but not so much that I pulled them off. So I was just going to keep them there, but then when I was drying off after the shower and I pulled the towel away from this arm, there was some like discharge on the towel, which kind of worried me because it was a little bit strange colored. So I said, okay, time to get these steri-strips off and see what's happening. And around that area, the steri-strips just came right off, while other areas they stuck to the skin quite a bit. And it turns out when I looked under where the steri-strips had come off, where the kind of discharge was coming from, that the wound is ever so slightly open still. I'm not sure if it closed and reopened or what, but basically there's a lot of pink, really raw flesh that's right there at this surgical wound, while elsewhere it looks like it's healed a lot more. So I called the doctor's office and I told him, I don't know what healing smell versus infected smell smells like, but there is a weird smell coming from the wound as well. So I called the surgeon immediately, of course, and he's out of town, and it's not like I could really get down to St. George anytime soon anyways, but he's out of town, so I talked to the woman at the desk, and she called an antibiotic prescription into a local pharmacy for me, so I'm about to go pick that up. So, as long as it's not MRSA, I should be fine. I'm a little bit paranoid about MRSA since taking microbiology last semester, but I'm trying to tell myself not to freak out. The infection prospect really doesn't scare me that much because, I'll just take the antibiotics and assuming it's not MRSA or VRSA or something similar, it should be fine. But it's the separation that kind of worries me because that means that it's probably going to take longer to heal than we originally anticipated, and also there might be more significant scarring than what we originally thought. So, at the end of the day, the thing I said even before I went and had the surgery was, I'll take a gnarly scar over a bunch of extra skin and fat any day. So even still, even if the scarring is pretty significant, it won't really bother me that much. But still, it is kind of unfortunate that this probably means it could have been less scarring and now we're gonna have a little bit more. So that's a bit unfortunate. But anyways, I wanted to, so they told me to just keep it wrapped, so I'm back to having my arms wrapped. My parents left town when it looked like I was doing really well, so I'm home alone right now. It's a little bit hard to wrap my own, I have to wrap one gimpy arm with the other gimpy arm, but I got this, it's more like, it's not a medical bandage, it's like a sports wrap, and basically the reason I got this one is because it automatically sticks to itself instead of just having Velcro at each end, so it's a lot easier to wrap by myself, and then I have a sterile gauze pad on, so that the obnoxious sports tape doesn't come into contact with the wound. So that's kind of what I've been doing now. I'm just the woman on the phone said, go pick up this prescription and take it according to the pharmacist's orders, and keep the wound covered with a cloth or gauze pad and wrapped. So that's what I'm gonna do, and then I call her back on Monday to, I guess, tell her how things have been going. I'm not really sure what I need to do as far as showering. Lately I've been showering, obviously, but now it's on the one hand I just kind of want to keep it wrapped forever and not have anything go wrong with it, but if it's an infection, naturally I do need to clean the area really well. So I'm not sure what I'm going to do for a shower tomorrow. We'll find out. Depending on how helpful the pharmacist seems, maybe I'll ask them their opinion on possible infection care. We're still not even 100% sure it is infected, because of course, I didn't go down to St. George and have them look at it, I just explained it, and so this is more, the antibiotic prescription is more of a precaution to make sure that if it is an infection, let's get rid of it kind of a thing, and I'm happy that they did that instead of make me wait for my doctor to come back to town in a week and then head down and stuff like that. I forget what I was saying. But anyways, yeah, so I might ask the pharmacist if they have any tips on care for possibly infected wounds that could be used on surgical wounds. So we'll see what happens, but I will keep you guys posted. And yeah, so that's the development that prompted a video sooner than expected.